Many of you know that I've been looking into hair transplants for 2 years. This is day 14, and I want to tell you now all the reasons why I decided, after 2 years of research, not to go abroad, to stay in the UK. In the meantime, while I'm reading this to you, I want to show you a video of my actual procedure for you to look at. I learned a great deal about having hair transplants abroad from people who have done it and from people who have had some issues with it. There is a lack of regulation and oversight. Many European and non-UK clinics aren't bound by strict medical regulations. In the UK, clinics must be CQC registered and surgeons must be GMC licensed. Abroad, almost anyone can operate under a technician label, hence making it cheaper. If you develop an infection, shock loss or poor graft survival, the original clinic can't realistically monitor or treat it. UK clinics typically follow up on a regular, sometimes daily basis at first, and you have emergency access to somebody. Abroad, they have excessive graft numbers, over-harvesting in other words. UK surgeons usually cap sessions around 3,000 to 3,500 grafts to avoid trauma and preserve donor density. Abroad, 5,000 to 8,000 grafts in one go is quite common. This causes severe donor depletion, visible scarring and permanent shock loss from over-trauma. Large sessions overstress the body's blood supply. This can cause not only transplanted hair to fall out, but existing native hair sometimes to permanently be lost. Most overseas clinics don't properly screen for blood pressure, diabetes or cardiac risk. Unqualified and under-supervised technicians. In some countries, technicians perform a majority of the extraction and implantation, not the surgeon. That means inconsistent depth, angle, placement and an unnatural-like result. Sterilisation standards vary widely abroad. Poor hygiene can lead to folliculitis, abscesses or even sepsis, especially when hundreds of micro wounds are created in one session. Over-harvesting destroys the donor area, leaving no viable grafts for future touch-up or corrections. Over-extraction can cause visible white dots, pitting patchiness in the donor area, especially under short haircuts. And then packing grafts too densely reduces the blood flow. Many of these follicles will die off silently within weeks after surgery, leading to patchy regrowth. And all this causes you emotional and psychological stress. When complications arise abroad, patients face anxiety, uncertainty and regret, and all because you wanted to try and save some money. Let that sink in.